3 are Eritreans, and 20 are Ugandans. 49 of the confirmed cases returned from abroad. 5 are contacts to confirmed cases. 8 were sporadic cases within the communities. 3 have an unknown chain of transmission identified and confirmed from several districts, including Masaka, Hoima, Adjumani, Iganga, Chotera, Masindi, Mutukula, and Rakai. Of the 79 truck drivers who tested positive for COVID-19, 35 have returned to their respective countries, and results have been communicated to their countries. And these include 20 who returned to Kenya, 11 to Tanzania, 1 to Rwanda, 1 to Burundi, and 2 to South Sudan. To date, 63 patients have fully recovered. Currently, there are 32 active cases admitted at various hospitals across the country, and all are in a stable condition. And these include Mulago National Specialized Hospital, 2, Entebbe Grade B Hospital, 7, Arua Regional Referral Hospital, 5, Jinja Regional Referral Hospital, 2, Masaka Regional Referral, 6, Hoima Referral Hospital, 1, Fort Portal Regional Referral, 1, Gulu Regional Referral, 5, Mbale Regional Referral, 2, and Kabale Regional Referral, 1. Uganda has not registered any deaths related to COVID-19. I would like to take this opportunity to appreciate His Excellency the President of the Republic of Uganda, the Commander-in-Chief for the COVID-19 response, for his able leadership and the over 35 guidelines issued to the general public for prevention of the spread of COVID-19. In the same vein, allow me to appreciate the general public for adhering to the presidential directives and guidelines issued by the Ministry of Health. You have been a very understanding community, supportive and responsible in the quest to prevent the spread of COVID-19 in spite of the enormous challenges. I especially want to appreciate your vigilance and alertness in identifying new entrants, both Ugandans and foreigners, who come into your communities and reporting them promptly to the authorities. These actions have enabled us to identify potential sources of infection and handle them appropriately to prevent further spread of COVID-19. The biggest challenge remains the issue of the truck drivers and the porous borders. The Ministry of Health appreciates your concerns in this area and the advice that many of you have provided through various fora. I want to reassure you that His Excellency the President of the Republic of Uganda is exploring all ways with his counterparts within the East African community to address this threat. I am sure that in his subsequent address to the nation, he will be highlighting the solutions. The Ministry of Health has also developed various proposals which will be implemented moving forward. In a special way, I would like to appreciate all health workers in Uganda for your dedication and commitment to save lives. I have seen a committed, selfless, and united workforce determined to fight this battle. It's not easy, but the good Lord will see us through. All health workers all over the country, the volunteers and the support staff, you are our heroes. May the good Lord bless and protect you all. During the lockdown, the health sector focus has been on preparing the entire country, the referral systems, and the hospitals in readiness for management of COVID-19 cases in the event that a phased lifting of the lockdown results in a surge of cases. From reports and observations, countries that previously had suppressed the virus, like South Korea, Japan, Singapore, and China, have had a rebound in the number of positive cases following easing of the lockdown. Ugandans, you have done very well so far through heavy sacrifice. Therefore, we must not allow the gains we have achieved so far to go down the drain. My humble appeal is that we work through this together and prepare ourselves adequately for the phased lifting of the lockdown. The following has been done by Ministry of Health, the scientists, and partners. The first is strengthening the regional referral hospitals to manage cases of COVID-19. Each of the 14 regional referral hospitals have identified and prepared 10 intensive care beds for critical care and 30 beds for management of moderate cases. In addition, 8 of the regional referral hospitals have the opportunity to manage COVID-19 confirmed cases as a way of testing their preparedness. And these include Entebbe, Masaka, Kabale, Hoima, Mbale, Arua, Gulu, and Jinja. Earlier on, Adjumani Hospital successfully treated a COVID-19 patient. The management of these patients in these hospitals has been good and very professional. To date, 7 cases have recovered and have been discharged from the regional referral hospitals. The second area that we have been focusing on is enhancing capacity of the district task forces to provide leadership and carry out surveillance, risk communication, and ensure that the presidential directives are adhered to. The capacity building has been achieved by emergency recruitment of epidemiologists and deployment of physicians and epidemiologists to be based in the regions to support regional and district functions and activities. The third area was carrying out a rapid community assessment survey, which was flagged off on the 26th of April 2020 to verify the presence or absence of community transmission. This survey continues to give us an insight into what is happening in the country as regards silent undetected transmissions. The survey confirmed sporadic cases in Masindi, Rakai, Chotera, and Mutukula, which are being handled with intensive surveillance, quarantining, isolation, and testing. And later on, I'll be giving comprehensive information on this rapid survey. The fourth area is rolling out testing of alerts and contacts to confirmed cases and sample removal to the regional and district level. The fifth area is quick identification of imported cases through the land border crossing for both inbound truck drivers and illegal crossings through the porous borders. The sixth area is enhanced risk communication and social mobilization. And seventh is to ensure continuity of essential and routine health services. I'll now give an update on the rapid assessment survey. Following the lockdown to suppress transmission of COVID-19, knowledge on the presence or absence of community transmission in guiding phased lifting of the lockdown, in addition to several other measures that were being put in place, was necessary. The rapid assessment was a necessity to rule out possible pockets of community transmission that could have been missed in the daily surveillance. Potential areas of worry included the porous borders with informal crossings, 2, many truck drivers who tested positive for COVID-19 and traveled through the country, and 3, contacts of some initial COVID-19 patients who were not tested on time. The following population groups were targeted: communities along the routes of the truck drivers, communities at the border crossing points, healthcare workers, market vendors, religious leaders, weighbridge area communities, highway law enforcement officers, including the traffic police, the UPDF, and the LDUs, police and prisons inmates, teachers at selected boarding schools, taxi drivers and conductors, fishing community, and communities outside the populations listed above. The preliminary findings. By 11th May 2020, a total of 14,061 participants had their samples tested out of the 23,414 targeted. 4 were confirmed positive, but none had a known link with a previous case. This meant an overall proportion of positivity of 0.03%, 3 per 10,000. The 4 sporadic cases were: 1, a 30-year-old male police officer from Masindi district; 2, a 48-year-old female police officer from Chotera district; 3, 40-year-old male truck driver identified among the border communities from Chotera district; and 4, a 22-year-old male, a Ugandan student at Bukoba in Tanzania, identified in Rakai district. The following preliminary conclusions have been derived from the survey. 1, there is no evidence of community transmission in Uganda at this point in time. 2, as evidenced from Rakai, Chotera districts, communities in border districts are at high risk. 3, regarding population groups, road law enforcement officers are also at high risk. 4, the early institution of the 35 presidential guidelines and the Ministry of Health standard operating procedures have interrupted and controlled possible transmission of COVID-19. I'll now talk about testing and the testing scale-up plan. Uganda has a large testing capacity of over 15,000 PCR tests per day. Some of this capacity is dedicated to other tests like the HIV viral load monitoring, surveillance of infections, and research. The country is scaling up COVID-19 testing capacity to 10,000 PCR tests per day in the event that need arises. Initially, testing was exclusively at the Uganda Virus Research Institute, which has done a tremendous job running up to 3,000 tests per day. We have assessed many laboratories across the country and have identified those that can be activated for testing in an organized way based on the dynamics of the infection spread and availability of reagents. The following laboratories have been assessed and are deemed ready: 1, Makerere University, Department of Microbiology and Immunology, which has already been activated to test the rapid survey samples. 2, the National Health Laboratory Services, or CPHL, as most people know it, will dedicate a capacity of 2,000 tests per day to COVID and will continue to provide HIV viral load and EID services effectively. 3, the Infectious Disease Research Collaboration in Tororo District. 4, the UVRI Plague Laboratory in Arua. 5, Gulu University Laboratory. 6, Rakai Health Sciences Laboratory in Rakai District. And 7, the laboratory in Fort Portal Regional Referral Hospital. In addition, we have equipped laboratories at Mutukula and Malaba borders with gene expert machines to reduce the turnaround time of results for inbound truck drivers. Additional labs will be added on the scale-up plans as we acquire them. Personal protective equipment. The Ministry of Health has disseminated guidelines on the use of personal protective equipment to all health facilities across the country, clearly spelling out the exact personal protective wear for the various levels of care. The National Medical Stores continues to distribute this personal protective wear based on the needs of the facilities. The budget for COVID-19. To date, the government of Uganda has mobilized and provided 314 billion Uganda shillings to the Ministry of Health to handle requirements for COVID-19. The total budget required for this response for a period of 6 months is 990 billion to support the COVID response. Sample transport system. We have boosted our national sample transport network with additional cars to allow rapid transportation of COVID samples to testing labs. We are also implementing a tracking system to allow us easily trace the samples and the results. Supply chain for test kits. We have made a projection of 3.2 million tests that will be required in the event of a surge of cases. Currently, the country has adequate tests to run for 2 weeks. More tests are expected by tomorrow, 15th May 2020. However, access to test kits remain a challenge as there is a global shortage and release to national governments is being rationed through the United Nations Consortium. Government and partners have placed several orders to make the test kits available in the medium and long term, but can only rely on how fast the consortium of the United Nations can make the kits available. In the interim, 360,000 tests have been ordered for, and another order is in the process. Infection prevention and control. Meticulous hand hygiene, social distancing, cough etiquette, and not touching the face, the mouth, and the nose remain fundamental in protecting oneself from COVID-19. An additional measure announced by His Excellency will be made later. I commend the public for their commitment to these measures. This has been demonstrated by a survey that showed that the coverage of hand washing has increased from 26% in the Demographic Health Survey indicator of 2016 to 86%, as showed by a survey carried out by Makerere School of Public Health. I'll talk a little bit on what masks are. Masks are garments that cover the mouth and the nose, just like the one I am putting on. In healthcare, masks are worn to protect either the user or the environment of the user, where there may be other people, against contamination by infectious agents. Broadly, two types of masks are used in healthcare setting: the medical masks and filtering respirator masks. These are made of unwoven fabric, commonly polypropylene. They are designed to filter out about 95% of aerosols. Those are particles of less than or equal to 5 microns in size. In East Asia, masks are broadly used by the public outside healthcare to prevent transmission of respiratory infections. Traditionally, international recommendations for use of masks have been for protection of healthcare workers when handling patients with infectious respiratory infections like tuberculosis and influenza. Masks are also used by people with respiratory infections to prevent the dispersal of infectious droplets and aerosols as they cough, sneeze, talk, or breathe. However, the relentless global spread of COVID-19, with its attendant mortality and stress on healthcare systems, has ignited the need to promote community use of masks. So why should we use masks in the communities? The rationale for community use of masks is to prevent infected people from dispersing the virus as they cough, sneeze, talk, or breathe. It is currently thought that virus shedding peaks at about 2 days before a person develops symptoms. As such, people without symptoms or just developing symptoms could infect many people before we know they are infected. With the current pandemic, everyone is potentially infectious. Reports from the Centers for Disease Control indicate that when a double cloth mask is used, with a filter inside, like a piece of tissue, it increases its protection to over 95%. Cloth masks have another advantage in that they can be washed overnight, ironed, and reused the next day. It is therefore strongly recommended for the general public, but not for health workers. In a review of 49 countries, it was found that 8 countries that had advocated widespread use of face masks: China, the Czech Republic, Hong Kong, Japan, Singapore, South Korea, Thailand, and Malaysia, had a lower number of COVID-19 cases per inhabitant than countries that did not advocate public wearing of face masks. Against this background, widespread use of masks for the general public is recommended. However, health workers should continue to use medical masks and disposable gloves in routine clinics, while those in COVID-19 isolation centers and those working in laboratories or taking samples should use the N95 masks. His Excellency the President, who is the Commander-in-Chief of COVID-19 response, will give more guidelines on how this can be rolled out successfully throughout the country. Status of quarantine. The Ministry continues to implement institutional quarantine for 2 weeks for contacts of confirmed cases. All individuals entering Uganda through the porous borders. Currently, 40 districts plus Kampala have institutional quarantine sites with a total of 1,100 residents as of 13th May 2020. Food and non-medical logistics were distributed last week to each of the 32 quarantine sites, and these include 50 mattresses, 50 blankets, 50 pairs of bed sheets, and some infection prevention and control items like soap, jik, and sanitizers. Food was provided from the OPM stores and distributed to the quarantine sites as well. I'll now talk about the communities at the borders with our countries. In the light of the reported ongoing sustained and diffuse transmission across the southern border of Uganda and the reported cases of Ugandans and refugees moving to and fro across that part of the border, the ministry intends to undertake intensified active surveillance, community-based surveillance, risk communication, and community engagement drive in the 6 districts of Isingiro, Ntungamo, Chotera, Rakai, Masaka, and Kalangala to create an epidemiological buffer zone. The intention of this epidemiological buffer zone between the neighboring countries and Uganda is to actively engage the communities through the village health teams. This is to increase awareness, reporting of illegal crossings, and identification of alert cases. Identification of alert cases, suspect cases, and link them to district health systems for epidemiological investigations and testing for COVID-19. It is through an enhanced community vigilance that the surveillance system, working with the communities, will identify persons who may have traveled to Tanzania or had contact with people from Tanzania and test them, and if found positive, they will be evacuated and managed at the regional referral hospitals. Given the increasing number of cases of truck drivers identified from a Legu border point of entry in the past 1 week, the ministry is conducting a risk assessment on the northern border to initiate a similar community-based approach of case identification and linking to the health system. Risk communication. In addition to other measures that are ongoing, today the Ministry of Health, together with the Ministry of ICT and National Guidance, with support from the Clinton Health Access Initiative, have launched a business API on WhatsApp. The free-to-use service will provide accurate, trustworthy, and up-to-date information about COVID-19, with the goal of keeping Ugandans safe and constantly informed about the virus. The WhatsApp Business API, which was developed in collaboration with Prakelt.org using TAN technology, is an automated chatbot service which will allow Ugandans to get answers to the most common questions about coronavirus from the Ministry of Health 24 hours a day. The service will also provide information on topics such as coronavirus prevention and symptoms, the latest number of cases in Uganda, advice on staying at home, travel advisory, and myth busting. The service will also enable the Ministry of Health to send urgent messages to all Ugandans who will opt in for the service. WhatsApp users can access the free information service by simply adding the number +256 32 32 00 660 I will repeat. +256 32 32 00 660 to your phone contacts, and you type any word like hi to get started. The Ministry of Health will also be publishing the number on its website and social media handles. In conclusion, and in light of the above challenges, moving forward, the focus of the ministry will be on the following areas. Number one is the border points of entry, targeting mainly truck drivers and travelers, and routes where they pass, stopping centers and communities around those places. Working together with the truck owners, we have developed an app that will enable the drivers to check in, be quarantined, tested, and remain in the pool. We hope that using this app, it will enable us to create a pool of negative drivers. However, the presidents of the East African region will conclude the discussion within the next 2 weeks, informed by the decisions of the ministers. We have already started consulting one another, and this app is being moved around. If it is acceptable to all the countries, we shall start applying it within the next 2 weeks. 2 is creating a buffer zone of intensified active surveillance, community-based surveillance, risk communication, and community engagement between Uganda and our neighboring countries that have diffused transmission of COVID-19. The third area of focus will be decentralizing to other areas, as I indicated earlier, including hospitals and points of entry. This is to enable quick turnaround time of results. 4, following the survey, the ministry will maintain sentinel sites in key areas, including transit areas, high-risk groups like drivers, people in contact with the truck drivers, and others. 5, community engagement communication, focusing on hand washing, social distancing, and widespread use of masks in public places. 6 is strengthening regional referral hospitals for management of confirmed cases and enhancing district capacities for surveillance. In conclusion, once again, I would like to appreciate the general public for adhering to the over 35 presidential directives and guidelines issued by the Ministry of Health. On behalf of the Ministry of Health, I would like to appreciate all of you, the private sector, the health workers, and all our partners for their continuous support to the health sector. The Ministry continues to appeal to you to remain calm and practice the preventive measures. Remember to wash your hands with soap and water, or use a sanitizer at least 3 times a day. Maintain your social distance at least 2 meters, and always wear a mask when you are in public. I thank you for listening to me.
Well, thank you so much, Dr. Jane Ruth Aceng, the Minister, for this very good comprehensive report that just given to the nation and all of us here. Now, one of those very highlighting issues that you've talked about here that has actually put me in high spirits is that there is no community transmission of COVID-19. That is one of the good things that I think Ugandans have actually got to. Now, we have members here who will ask questions, and I request that for those who are actually represented or representing their media houses, this is live on all TVs in the country. But for those who are here, they will have an opportunity to actually come and ask different questions to different scientists. As they're getting ready from me, Honorable Minister and the scientists, we've steadily and slowly learned how to deal with COVID-19. I just want to ask a question whether the experts, you, the doctors, have considered or have done an assessment of the clinical course and the prognosis of COVID-19 using the Ugandan experience. We just need to get from that. Then there's also another issue over the antibodies. We've been told that many of the patients of COVID-19 have developed antibodies within them, but their immunity is actually very unclear. And because of that, we're also asking whether you've considered to test for immunity for coronavirus or the testing for the antibodies themselves, because we know that many of them are questions from members of the fourth estate. For those of you who are here, the usual suspects. Yes, my comrade, please just come here, say your name and the media house that you're representing, then make your question audible, clear, and possibly short if you can, to whoever you're actually asking. And of course, all the others are also ready to ask their questions. I'm sure there are questions that are coming through from the public, and I think they're getting to Emma's phone. I will get an opportunity to also hear from them. You're welcome. Just look into this camera, tell us your name and the media house that you're representing.
Thank you very much, Innocent Kaiser. I'm a freelance practitioner. I would like to...
Innocent
Kaiser.
Kaiser, Innocent.
Yeah, I would like to ask to commend the Honorable Minister for the statement. Thank you so much for your leadership. Well, my question is very simple. In the simplest terms possible, what are you going to recommend to the President? Should he extend the lockdown or should we lift it? Because, Madam Minister, where I stay, when the President extended the lockdown recently, just the mere hearing of it, one of my neighbors simply dropped and died. I would like you to tell us, do you think it's advisable to keep on extending these lockdowns, and at what cost? Secondly, I would like to ask the Permanent Secretary, we understand that government has allocated a lot of money to fight COVID-19, and we see that many people have been donating. I would like to know, how have you managed to use these resources? Are you at any given day going to come out and give us some kind of accountability, or that is not going to happen? Thank you.
Well, thank you so much, Kaiser, a freelance journalist here, and as Walter comes over, I'll just make an addendum to what Kaiser said on the lockdown, Honorable Minister and the experts here. There's an old saying in English that necessity is the mother of inventions. I'm only also asking that, can necessity be the mother of adaptation, and we see how we can actually adapt and live with the virus. Walter, you're very welcome.
Thank you very much. My name is Walter Mwesije from NTV. I have a couple of questions, and very quickly, the Minister mentioned that proposals that are being brought forward for implementation. We would like to understand what those proposals are, what do they intend to achieve, and if they also concern truck drivers.
Walter? Minister wants to know the proposals that you talked about.
Yes, in her speech, she mentioned that there are proposals that are being brought forward for implementation. Yes. Yes, so we want to know what proposals are those, and what is the status of border testing. You did mention, but we want to know the mobile labs are active for now. Then Kalangala district officials have a complaint that the team that is carrying out the rapid survey not reached there. They only stopped in Bukakata. We want to know the reason for this. And yesterday, the World Health Organization mentioned that it is unlikely that COVID, will go away in the near future. And if it's going to become an endemic, then are we resorting to a lockdown as a strategy, or aren't governments just postponing the obvious and really not solving the challenge at hand? There are also complaints from some frontline health workers who have not received their pay. Would like to know why and what could be the problem. Then among the patients that have been diagnosed with COVID-19, how many have had underlying medical conditions? And if there are, how is the prognosis compared to those without any underlying conditions? There's a case of a truck driver who's tested negative in Kenya, but here in Uganda he was tested as positive. I don't know if you've received that information and what your comment would be about that matter. And finally, the border districts are also complaining, of floods. So we want to know if, screening for these people who are in congested places is going to take place, especially by the team that is carrying out the rapid survey. And HIV is still with us, so we want to know if there is any plans for awareness on the HIV Vaccine Awareness Day. Thank you.
Thank you so much, Walter Moisture from NTV. Let's have Zahra Namuli here from NBS TV, as we'll welcome Dr. Wayengera to help us allocate these questions. You're welcome.
Zahra Namuli from NBS Television. A couple of questions as well. On the truck drivers, Honorable Minister, we've heard of countries that have closed their borders. Is this something that you are advising the presidents to do? Because you said the health ministers are advised or have proposed some ideas to the head of states. Then you've talked about the 300. Pardon? Close the borders completely for countries like Tanzania, because we've seen Zambia do the same. We've heard of the 300 budget to the health sector. Has some of this money finally trickled down to the Uganda Virus Research Institute that asked for 1 billion shillings months down, and this had not yet come in? On the use of the gene expert machines at the border points, it's something that you have promised for so long. Can we finally put a date on when this will start? Because when we tell the viewers that results will be availed in 45 minutes, and days, weeks later, we are still saying truck drivers are being traced, when will this start? Then when you begin doing, does that mean when you test positive at the point of entry, you're return back to your country, or are you allowed to continue and be traced, as the ministerial statements usually state? The president had advised that we carry out a verbal autopsy to identify if we have some people who have died of COVID-19 and had not yet maybe come to the hospitals. This been done, and what are the statistics? Lastly from me, you were looking for about 18,000 travelers from the high-risk countries have been identified, and I think about 8,000, according to your health dashboard, have not yet been identified. Should we now tell them they are free and should stop hiding? They are safe from COVID-19?
After the incubation period that you told us about. Well, Dr. Wayengera, just a minute. There are questions coming in from, just give us a few minutes. Emma here has some questions that are coming in through social media platforms. Make them very quick, Emma.
Thank you. Emmanuel Inebiona, Senior Public Relations Officer at the Ministry. The question coming in from the public, who's saying everyone is on the road, people are gathering downtown, joggers and leisure walkers have increased on the road, cars have increased on the road. Is the lockdown still meaningful? Then there's another one which indicates that the World Health Organization has said we should prepare to stay with like any other disease. What is the implication of that statement? Then another question is indicating indicating that I think Walter had highlighted it. It's from Oto, Uganda Network. Reports indicate that Kenya has overturned Ugandan COVID-19 test results on a Kenyan truck driver. What does this mean? Have you had this communication from Kenya? Is it possible that they got a different truck driver or he did it here? Thank you very much. Another one is from Cecilia Nyon. She says, why is it hard for us to track the foreign truck drivers when we register them when they are entering the point of entry? Thank you.
This will go to the Minister, Dr. Waingera, when you're positioning the issues on an Ebola alert. And we need to know, because we are just very surprised at how meticulous we all are on the statistics of COVID-19 disease, to the extent that we even check those that, we even actually own those that are not from our own. For example, we count and we keep counting, and every other case is a case, and then we are just very, very concerned with the statistics of COVID-19 as opposed to all the other diseases. You put us on an Ebola alert. We want to know how far that has gone, because we never look for these people and count the numbers as we are counting them for coronavirus. What could be the secret of the statistics? Welcome, Dr. Waingera.
Thank you. Good evening, viewers. Thank you, Zikusoka, moderator. Misaki Waingera is my name. I'm here to lead the Scientific Advisory Committee as they respond to the Minister, to the public's questions. Once again, I need to reiterate that the multi-sectorial nature of the response to the COVID-19 pandemic, and we are here to brief only on the response by the health sector. I have 11 scientists whom the Minister has introduced, 2 of whom are the lead investigators for the rapid assessment survey. Thank you. So I received several questions, of course, starting from you, whether experts have done the study of the clinical course, and I will request Pauline to the clinical course of disease, COVID-19 disease.
Will you manage? Oh, very good. Very good.
Thank you very much. I'm Professor Pauline Biachika Chibwika from Makerere University. The question about the clinical course and prognosis of patients with COVID-19, and specifically for Ugandan patients. So what we have seen for Ugandan patients is that majority were asymptomatic. And those who are asymptomatic, meaning have clinical symptoms, but tested positive for COVID. Some of them later on developed symptoms along the way at about 5 to 7 days along the course from when they tested positive. And some remained asymptomatic all through. The question is, prognosis for Ugandan patients has been very good. As you have read to you the numbers of patients who have recovered and actually discharged. They have tested negative twice for COVID-19 using the PCR test. So their prognosis has been very good to date. The other question was regarding the comorbidities. Yes, we've had a number of patients with comorbidities. The commonest has been hypertension, which is high blood pressure. Other comorbidities have been small numbers of patients also had, and a few had previous history of having been treated. However, majority of these patients have actually done very well. They have negative twice subsequently and have been discharged from the hospital. Thank you very much.
Thank you, Professor Biachika. Second question from you, Zikusoka. many patients develop antibodies, but the specificity of these antibodies is not quite clear. Have we considered studying this? I will ask both Professor Kalebu, because this applies both to the diagnostic side, but it also applies to therapeutic. At the point we are looking at the possibility of actually using plasma, there is a study that is being rolled out to consider using plasma from patients recovered for treating COVID-19 cases. But Professor Poncho, please come and respond to this.
Thank you very much. I think antibodies are very important, as Dr. Misaki has mentioned, important for diagnosis, but they are also important in our protective immunity, whether we are protected for reinfection, and they are using those to see whether we can design a vaccine that will induce antibodies to prevent infection. So you ask whether antibodies, their role, is it clear? And I think that's an important question that is also being studied. For most other coronaviruses, there's some belief that antibodies could be protective, because for some of the other coronaviruses that infect humans, they are protective. For COVID, there have been a few cases where people have been reinfected, but those have been few. But this subject is still out there to be tested, especially when we have our vaccines that will be introduced that are being worked on to see how these antibodies in this vaccine will be able to protect. But we are hopeful that these antibodies will be protective in the majority of the individuals. The other challenge we have with these antibodies is that don't last long. For some of the studies they have done, they have looked at, these antibodies do disappear after a few years. So these are, again, studies that are going to be done. They're a bit of unknown. But generally speaking, as scientists, we have hope that antibodies will be helping us. Antibodies do develop around the 5th day, the median time from the time people get symptoms, and the first antibodies to develop are what we call the IgM and the IgA, and then at around the median of 10 days after the symptoms have appeared, we start getting the IgG antibodies. So these will be quite helpful in future if you are looking at surveillance, looking at individuals who have ever been exposed, but they're not so important for individuals in acute infection who want to identify and track, but they're more relevant later. But yes, it's an important question. We hope we shall have better answers as we move forward.
Thank you. Professor Dennis Biarugaba, please come and talk about what you have found with other coronaviruses in terms of antibody responses. Professor Dennis Biarugaba has been studying coronaviruses for the last coronaviruses and other flu causes for the last over 20 years. He leads the National Flu Surveillance group in Uganda, so he should be able to tell us what he has found previously.
Thank you very much, and good afternoon, viewers. As we have mentioned earlier, there are a number of different coronaviruses. Right now, there are about 6 of them, and that includes the current SARS-CoV-2. Apart from the 3, that is the SARS-CoV-2, the MERS, and the SARS initial one, the rest are common coronaviruses that normally appear with the normal common flu, which we are used to. We did screen sera from some patients, and we found that they had antibodies against these coronaviruses. And the prevalence, or the number of people that were positive, was actually very high, up to about 60–70%. This indicates that actually these coronaviruses, the normal coronaviruses, saturate within the population, and the population actually has antibodies against these coronavirus. What we have not done now is to find out if actually they protect against each other and they can protect against the current pandemic. We will be evaluating that to see whether there is cross protection, and possibly that could help us so that if a big proportion of the population has got antibodies and they are able to protect against this new coronavirus, then it means some of the population will be able to protect themselves. Thank you.
Thank you, Dennis. From Innocent Kaiser, we had, first of all, I want to say sorry for the loss of your neighbor. Any circumstance that raises anxiety is potentially able to lead to death, sudden death, particularly from cardiac arrest. But we are sorry about that. First of all, it is important, by the way, that you appreciate that, I think the country needs to appreciate that the country has started the process of lifting the restriction measures. And already, what you need to appreciate is that this is being done in a phased way. We cannot suddenly open up the entire country at once. Why? Because we have to look at many things in order to be able to see who is at most and how should we ensure that we protect them. I have a question that is directed to the PS about funds, and I will leave that for the funds, but I will ask Dr. Wanyenze to come and talk about the process more in terms of what we are doing, lifting the lockdown. We are not extending the lockdown. We have actually started the process of lifting the lockdown. And people need to appreciate that. The last address by the President let off a few sectors. That will continue as we evaluate. Thank you, Professor.
Thank you, Misaki. My name is Rhoda Wanyenze, Makerere University. The question on the lockdown also related to a similar around learning to live with COVID-19. First, I will re-emphasize that a lockdown is not a permanent measure and is not the only preventive tool that we have for COVID-19. A lockdown is very effective in terms of controlling the disease because of reducing the rate of mixing between people who are infected and those who are not. But it's also very critical in terms of allowing us to prepare and improve our capacities. You heard what the minister listed, expanding the testing capacity. Now we are approaching 10,000. We have prepared the regional referral hospitals to care for people. We have activated and expanded the surveillance, especially in the highest risk border districts, and so many other achievements, including the study that is going to show us what is happening in the community. And we are now relieved to hear that we don't have established community transmission in Uganda. At the same time, when you're preparing for a lockdown, you need to have a plan. How do you actually lift the lockdown so that we don't undo the benefits that we have? So we have a comprehensive checklist that includes the capacities that we aimed to build, the survey, the risk communication, the testing, the care, and we have targets for this. It's very comprehensive, and we have been reviewing this, and we are continuing to do. It also includes step by step. How can we actually do this in a controlled manner so that we don't end up in chaos with the numbers going up abruptly? So we are doing this carefully, and like Misaki mentioned, in the previous address by the President, there were some steps towards beginning to ease this, but we need to know the lockdown released is not permanent. You can't release it and then you have a lot of challenges and you have to step back. But it's in our hands, each and every one of us, make sure that when this process begins, we do our part so that we continue to lift it. And how can we do our part? We need to ensure that each of us keep your family safe, keep your institutions safe if you go back to work, so that we don't have many cases piling up. Because if we do that, then we might end up taking a step back overall, or even ending up with localized ones, because that is also possible, where you can lock down maybe one town or one district has issues, or you can lock down a workplace which has challenges. So that is also an option, but all that is in our hands. The ministry can guidance, the president will give us the guidance, but each and every one of us has to do something. The other thing I would like to emphasize is, as we wait for the president to communicate to us in terms of whether we are continuing to not, each and every one of us should be thinking, how are you going to live your life if you are released work? How does your workplace look like? If you're a manager somewhere heading an institution, plan in terms of how your people safe. Have you actually interfaced with this plan, and do they know what to do? Because sometimes we plans and then we keep them. You keep it, but the people who are going to use it actually don't know, and they are the ones that are going to ensure that they're compliant and that others around them do similarly. So develop a plan with your workplace and let everybody give feedback on it, be able to plan how they are going to. Are you going to change the seating arrangement? Are you going to change several other things that need to happen? So we all need to prepare. Otherwise, we might be released, and even when we have guidelines from the president and from the ministries, we still face from challenges. And we need to realize that when we eventually do, that we might never have enough people police all of us wherever we are. So it's each and everyone's responsibility to make sure that when this journey begins, that we actually do a good job. And
Kubako mukwano nekwaniriza mu munyo ogwebunayira olunaku luno olwaleero osiibye otya gy'otusizaako engalo nje kwebaza nti weebale kubanga ogikoze ate gwali waka gamba nti amaka ago g'olimu mulimu gwennyininyini omutongole. Nze Nabwire Fede ntuse n'omunyo gwira gubeerawo buli bbalaza paka ku lunaku olwokutaano essaawa ziba 11 ez'akawulire ate yagaba gavudde ebweru w'eggwanga lyattu Uganda. Abo babyabulamu bw'obadde olaba bagenda mu maaso n'okwogera ku kirwadde ekya COVID ekisinga okusoomooza. Bagamba nti abalwadde abasinga bakebeddwanga nga balina ekirwadde kino naye nga babadde nga tebalaga bubonero. Kitegeeza nti nze naawe tusaanidde okukola ab'ebyobulamu bye batugamba okulaba nti ekirwadde kino tukirinnya ku nfeete. Bibadde bikyali bwe bityo, ekitongole ekivunaanyizibwa ku byobulamu nsi yonna ki World Health Organization nga kiyitamu akulira ebibamba n'ebibuze Dr. Mike Ryan kigamba nti ekirwadde kino sikyakuggwawo kati. Ababadde bakirindiridde kirimu bagamba nti endowooza eyo tugisazeemu kubanga ekirwadde kineno kigenda kuwangalira ddala n'abagala ne bwe linaaba lizuuliddwa tekitegeeza nti tujja kubanga tumaze okukiwangu. Abakyalinze ekirwadde ekya COVID-19 mbu kiggweewo mudde ku mirimu si byakati yonna eky'ebyobulamu. World Health Organization kirabudde nti kyandifuuka ekirwadde ekyo oba okumala emyaka nga kikyali mu bantu okwetooloola ensi yonna. N'ebigo bitalaze